Hi, I'm Dr. Roger Levin, CEO of Levin Group, and I'm speaking to you today from our headquarters in Baltimore, Maryland. The topic of this conversation is case presentation. Boy, has that changed. Case presentation, and it's time to call it what it is simply selling. We are trying to sell the patient a specific treatment that we would like them to accept. At Levin Group, we always recommend that you recommend ideal treatment. Every patient should know the ideal comprehensive treatment that you think they should have, and don't be afraid of whether or not they're going to accept it. Our clients today are closing 90% of all the cases they present, from single teeth to comprehensive complex cases, from need-based dentistry to aesthetics and to implants. How are they doing it? We've added a whole dimension of human relations into the process. Things like when you're talking to a patient, you want to be in a quiet area with no disruptions. You want to present treatment, but after that, you want to listen 80% of the time. I was at the Harvard Business School and recently heard them talk about listening skills and that the most effective listeners listen 80% of the time. People literally talk themselves into accepting treatment once you've properly explained to them what you're trying to accomplish. Sit at eye level with the patient. When you sit higher than a patient, you sound authoritative, you're looking down on them, and women especially react negatively to that today from both women and men. Make sure you make eye contact. Don't just look at notes. Don't just look at a chart. You look unprepared, you look disorganized, you look like you're winging it. And by the way, I am a general dentist. I was in full-time practice for a number of years, and many times we are winging it. We go in, look at the chart, and start presenting treatment. Make sure you're ready in the morning meeting that we now call the daily business meeting to create a focus on business, where one of the agenda items of the 15 agenda items is who are we presenting treatment to today, and are we prepared? When you're talking to the patient, touch the patient periodically. It's okay to touch a hand or touch an arm, and it makes physical contact. It creates comfort. Offer the patient a beverage. People are much more comfortable if they've got coffee or tea or a diet soda or regular soda in their hands. Respect their time. If you're running late, people get antsy. Americans are absolutely overwhelmed today, and when you run late, their brains turn off. All they're thinking about is leaving. Take their pulse. Ask them along the way, how do you feel about what I'm saying? Am I being clear? Is there anything you don't understand? And finally, make sure you offer additional consults. 65% of patients receiving multi-thousand-dollar treatment presentations need a second consult, and 15% need a third consult. Follow these guidelines and your treatment presentation will improve immediately. I want to thank you for spending this time with me. If you'd like more information, go to the Levin Group website, levingroup.com. Go to the Resource Center, where you will find an extensive amount of free and valuable information waiting for you. I wish you continued luck and success.